When families recognise that they require the services of a care home and begin doing their research, the fees can come as quite a shock to them. However, when you break down the individual elements of the care fee, then the cost becomes easier to understand. Every individual who requires care receives a tailored care package consisting of varying levels of person-centred support in addition to a place for them to call home. Being the largest employee-owned healthcare provider in the UK, our goal is to deliver the quality of care we would want for our loved ones at a fair and transparent cost. So what makes up our care fee? Over 70% of our care fees relate to the cost of our employees delivering care at our homes. This will include the salaries of our care workers, but also our cooks, cleaners, maintenance operatives, activities coordinators and management teams. We are a real living wage employer, so we've already committed to a minimum hourly rate agreed by foundations across England, Scotland and Wales. All of our care homes are purpose-built, and as with any building, there are the associated running costs to make sure that they're well maintained, in full working order and also look welcoming. This equates to about 13% of the care fee. As with most care home operators, Shaw has loan repayments or rental costs to factor in, as well as the utility costs and IT infrastructure costs. As a business, we must also facilitate the waste management of the building and the associated costs. While being mindful of our impact on the environment, we ensure that we put methods in place to recycle and reduce our carbon footprint as much as possible. Our buildings are in constant use, so we also have building maintenance, servicing, ground maintenance, cleaning and external contractor costs too. In addition, there are also other care operating costs, which equate to about 7% of the care fee, and these include insurance, medical purchases, food, activities and entertainment, and registration fees. We are a national company with over 60 care homes, so have a head office function to provide central support to our homes around the country. These costs equate to about 5% of the care fee and includes payroll, finance, HR support, compliance and quality support, advertising and marketing, training and also regional support for our operational teams. If you've been adding these percentages up, you will have noticed that there is 5% or roughly £40 to £60 of the weekly fee not yet allocated. We set our fees every February and fix them for the following year. This means that in theory, the remaining 5% could equate to our profit. In reality, however, and in recent times, this amount has been used to cover unexpected costs, such as food and utility inflation, which have risen significantly greater than we anticipated. It also acts as a buffer when we have empty rooms, which we have to cover the costs for. Therefore, our actual profit over the past 2 years has been lower than 5% for many of our care homes. We are lucky to have non-care divisions which are profitable and enable us to reinvest into our care division. Over the past 2 years, we have introduced electronic care plans to improve the quality of the care being delivered. Many care providers are not as fortunate as us and have been forced to exit the market. Others have struggled due to their business models requiring unsustainable profits to cover the repayments of their bank loans. We don't aim to make big profits, but to be a sustainable business for our residents and employees. We know from experience that this is achieved by ensuring that each of our homes are able to stand on their own 2 feet. We believe our vision and operating model will allow us to continue delivering high quality care at fair prices for a long time to come.